Did.
Exciting. Okay. Everybody good?
Yep.
Good. All right. Good afternoon, everybody. Today is Monday, April the 13th. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, here with my fellow commissioners, Commissioner Ken Lawrence and Commissioner Joe Gale, Dr. Al Long, Regional EMS Director, and Dr. Brenda Weiss, Administrator of our Office of Public Health. First, a sad note today. We want to extend our condolences from the entire Montgomery County family to Mercy Fitzgerald Hospital EMS, Crozier Chester Hospital EMS, and the family and loved ones of paramedic Kevin Bundy, who died in the line of duty yesterday. Paramedic Bundy, just 33 years old, made the ultimate sacrifice while serving on the front lines as an EMS worker during the COVID-19 pandemic. I also want to announce that this week is Telecommunicators Week. The telecommunicators, I'm looking straight at them, though those of you who are watching me can't see them, but they are an extraordinary group of people who work 24 hours a day, 7 days a week. In 2019, our Montgomery County telecommunicators handled 770 to 713 incoming calls and text messages, averaging more than 88 per hour. These folks do amazing work on the phone. They teach people and describe how to do CPR. They walk through helping people give Narcan to someone who's overdosed, and every once in a while they even get to help deliver a baby. So we want to just extend our most heartfelt thanks to them for the work that they do every single day of the year. And if you know any telecommunicators, make sure that you thank them this week. So since our April 11th press release, we have had 107 new positive cases of COVID-19 in Montgomery County from Saturday to Sunday, and 101 new positive cases from Sunday to this morning, which brings us to a total of 2,023. That's 2,023. We are not going to go through the municipal breakdown or the age bracket breakdown today. We are still playing a little bit of catch up over the weekend, but we hope to have that information to you by tomorrow. I am also saddened to confirm that 9 more Montgomery County residents have lost their lives to COVID-19 on Saturday, and 14 additional lives on Sunday, which brings our total for the county to 91 deaths from COVID-19. Again, we don't have our full breakdown on that, but we'll hopefully be back on track with that tomorrow. We continue to do a good job on social distancing. Our hospitals continue to get a little more full, but all 9 of our hospitals here in Montgomery County do have empty beds and empty ICU beds, and so we are grateful for that. We are particularly grateful for our SEPA SMART team. The Southeastern Pennsylvania Surge Medical Assistance Response Team has arrived at Suburban Community Hospital and has set up a 35-bed hospital that can accommodate both COVID-19 positive patients and non-COVID-19 patients, should our hospitals in the region require surge capacity. Myself and my colleagues toured the site this morning, and we are just so grateful for the work of everyone at Suburban Hospital and for the SEPA Surge team. It looks fantastic. The SEPA Surge equipment has come in, which does include ventilators in very compact and very easy to use setups. And so we're just very, very thankful to them for getting this work done, particularly over a holiday weekend. As I have said all along, we hope that we won't need this surge capacity, but should our other hospitals in our region become full, we will have this ability to send patients to our SEPA SMART extra beds at Suburban Community Hospital. An update from our correctional facility. As you recall, early Friday morning, we were notified that that 2 inmates at the Montgomery County Correctional Facility had tested positive for COVID-19. Those 2 inmates were quarantined on April 7th after being seen by the on-site medical provider. These 2 inmates remain in isolation and are stable. The cellmates of these 2 individuals are currently asymptomatic and also in quarantine. So all 4 of those individuals are doing well and are stable. As a result of the potential exposure, 155 individuals remain in quarantine and all are asymptomatic. Additional updates on the correctional facility. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 1,015 today, a net decrease of 327, which is a 24% decrease. Since March the 12th, there have been a total of 501 discharges. The average number of daily commits is now 5 to 6 per day, compared with an average 28 per day prior to March 12th. We continue to track and check in with the 75 Pennsylvania Department of Health licensed long-term care facilities in Montgomery County, along with other congregate care settings with overnight services. The Offices of Health and Human Services are conducting coordinated efforts to have daily contact with these facilities. Some of these facilities do continue to have, and some are just starting to have, some individuals with COVID-19. The vast majority of facilities have just 1 or 2 cases. We do have a couple of facilities with bigger numbers. In total, related to these facilities, we have 306 cases among residents and 166 cases among staff from these facilities. Outreach is being done to our hardest hit facilities in order to assess the needs, help provide guidance on CDC guidelines and PA Department of Health guidelines. As I said, we are in daily communication with many of these facilities. We are assisting them with their personal protective equipment requests and delivering PPE to them. We have given a list of the highest priority locations to ECRI, which is the organization that the Pennsylvania Department of Health has contracted to assist these long-term care facilities. And today, I'm pleased to announce a collaborative partnership with real-time medical systems monitoring. We will be offering this free service starting tomorrow to any long-term care facility with an electronic medical record. The facility volunteers to share anonymous patient data, including the number of patients with fever or cough, with our Office of Public Health, with the goal of assisting these facilities with trend tracking and early response. Real-Time Medical is donating this service for the purposes of helping us manage the COVID-19 pandemic, and we want to thank them and are very grateful to have this resource. Now some updates on the community-based testing site. As of April the 9th, we have tested 4,844 individuals. We have 90% of the results back. And overall, during the entire period of testing from March 20th to last Thursday, with 90% of the results back, we're running 16.8% positive. That's overall. Based on the results from our testing site, it appears that we may have peaked in terms of positive test results early last week. And that's looking at the particular day that people were tested and the number of positives we had back on that day. We believe that we peaked early last week. Now, to be clear, this just applies to the population that went through our community-based testing site. This may not apply to long-term care facilities or other communities. So we just want to put that caveat on it. But for the population that has gone through our testing site, we believe that we may have peaked and are starting to see those numbers come down. As we announced last week, the site will be relocating to the Montgomery County Community College campus. We are still hoping to be open on Wednesday, but the weather today did cause some setbacks. They couldn't get out and do some of the outside work that they had hoped to get done today. They are going to try to get us open by Wednesday, but stay tuned and we'll let you know for sure tomorrow if that is going to be the case. The registration for tests will be the same with an online component, or people can call. We will be asking for a little bit more demographic information from people so that we can better track our case results, our test results. And we are going to start a waiting list when we reopen up. Since we do have a number of cancellations every day, we're going to take a number of people on a waiting list so that if people cancel or don't show up, we have additional individuals that we can call and try to get every one of the 250 tests that we have available to us done on that particular day. And then finally, I just want to go back a little bit to social distancing and show you today's chart. This is a chart that goes through the number of people in each age cohort that have tested positive for COVID-19. And you can see that starting with the 20 to 30 year age group, that's the first very big blue bar, we have a large number of people, even in their 20s, who are testing positive for COVID-19. So I again want to dispel some of those sort of early ideas that were out there that nobody got this disease in their 20s. That's just not true. What is true is that we have not seen anybody in that age bracket or anyone in their 30s pass away from COVID-19 in our county. Other counties have seen that, but our county has not. The orange top on some of those blue bars are the individuals within that age bracket that have passed away from COVID-19. So you can see that as people get older, their chances of dying from COVID-19 do increase. But I want to make sure that everybody understands that anybody can get this disease, regardless of your age. You may not get it as severely as your grandparents do, but anybody can get it. And that's why it is so important that we continue to remain at home. We are absolutely not through this yet. Keep doing what you're doing. We saw some data over the weekend that Montgomery County leads the state in the reduced mobility in our county. Kudos to everyone who has been part of that. We thank you so much. We know that this is coming at significant personal sacrifice. And we know that it is very stressful for so many. And we just have to ask you to hang in there for a bit longer so that we can make sure that when we do start to unwind this, we do so in a way that's safe. I want to continue to emphasize how important it is to reach out for help if you need it. We have our Navigants who are over here today. We have our Navigants number for anyone who needs any help with a human service need. Their number is 610-278-3522. And I also want to stress how important it is to share your anxiety, your depression, any other emotion that you might be feeling through this with friends or neighbors or any of the available hotlines. It is still okay not to be okay. And it's going to be that way through the duration of this. And so I don't want anybody sitting alone thinking that they're the only one who's struggling. Just about everybody I know is struggling on some level. So know that we're all in this together, and the only way we're going to get out of this is if we hang together. So please keep doing what you're doing. We're doing a great job as a county, and if we keep at this, it will be over as soon as possible. And with that, I'm going to turn it over to Commissioner Lawrence.
Good afternoon. I'd like to provide an update today on the Montco, PA COVID-19 Response Fund. This fund was established on March 26th and is being administered by the Montgomery County Foundation. Its purpose is to support first responders and safety net organizations providing critical services during the COVID-19 emergency. As of today, $290,000 has been raised for the fund. This includes $59,000 in donations from private individuals. And we want to thank all of the foundations and the individuals and businesses who have contributed to the fund. During the first week, 60 nonprofits applied for grants totaling $245,000. A total of $141,500 has been awarded to 41 nonprofit organizations that are working on the immediate needs of residents hardest hit by the pandemic and first responders. In the first round, grants went to support a variety of basic needs programs, including food pantries, senior care programs, rent and utility payment programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, protective personal equipment purchases for nonprofits that are continuing to operate and provide essential in-person services and emergency shelters. Projects were prioritized for funding based on the geography served, the capacity to meet the higher demand for services, and whether the project targeted particularly vulnerable populations. Additional considerations were given to ensure the needs of historically underserved communities, such as recent immigrants or people of color, were also being met. The Montgomery, PA COVID-19 Response Fund allows individuals and businesses to donate money towards COVID-19 relief efforts. More funds are urgently needed. There's a lot of need for our first responders and our social safety net organizations. The needs are tremendous and they will continue to grow. The fund continues to accept grant applications and will award additional grants on a rolling basis. To apply or contribute, you can visit our COVID-19 data hub at www.montgopa.org/COVID-19. An election update. Tomorrow, we are 7 weeks away from the primary election, which has been moved to June 2nd. Our voter services office is open and preparing for the election. However, we are facing tremendous challenges in securing poll workers, and we are losing polling locations. The safest way to participate in this election is to apply to vote by mail, which you can do at www.votespa.com or call 610-278-3275. The deadline to register for the primary is Monday, May 18th. The deadline to apply for an absentee or mail-in ballot for the primary election is Tuesday, May 26th. And tonight we want to thank State Representative Joe Cerisi, who is spearheading a countywide effort to thank our EMTs, nurses, doctors, police officers, and health and safety workers who are on the front line of this pandemic. He is asking houses of worship across Montgomery County to ring their bells at 7:05 p.m. tonight for 5 minutes to acknowledge our heroes on the front line of this pandemic. So tonight, please chime in and ring your bells at 7:05. If you have a cowbell, you can ring that as well. And with that, I'll turn it over to Commissioner Joe Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. The Montgomery County Chamber of Commerce has organized a free virtual town hall presentation on how to navigate small business loans during the COVID-19 pandemic. This no-cost town hall is open to both members of the Chamber of Commerce and non-members. This informative virtual town hall will include a presentation by the Director of Temple University Small Business Development Center. The discussion will cover various loan programs available to small business owners, including programs from the CARES Act, like the Payroll Protection Program. The presentation will also provide instructions on how to navigate and apply for economic injury disaster loans and Small Business Administration Express Bridge loans. There will also be time for a question and answer session. To participate in this town hall, you must register before noon tomorrow, Tuesday, April 14th, so please do not wait. To register, please visit the Montgomery County Chamber of Commerce website at montgomerycountychamber.org or email ryan@montgomerycountychamber.org. Again, that email is ryan, R-Y-A-N, at montgomerycountychamber.org. Once registered, you will receive instructions on how to join the virtual town hall, which will be held tomorrow, Tuesday, April 14th at 3:15. As a proud graduate of Temple, I would like to personally thank the Temple University Small Business Development Center for providing guidance to our local businesses during this unprecedented and confusing time. And of course, thank you to the Montgomery County Chamber of Commerce for organizing this virtual seminar. I've always been a champion of the Chambers of Commerce in our region and the support they give our business community. In addition, there's some other news today other than the coronavirus, but it's not pleasant news. Our area is currently facing a lot of storm weather. It's experiencing large gusts of winds between 70 and 90 miles per hour. The National Weather Service has also issued a tornado watch until 6 p.m. this evening. And if you have anything outside that could blow away, please make sure to secure them or bring them inside. Now's a good time to do that. And be sure that all your devices, such as cell phones and laptops, are fully charged in case today's storm knocks out power. In the event that you do lose power, please do not call 911. That's for emergencies only. Please notify your utility provider. If you're in the region that's covered by PECO, the telephone number for PECO is 1-800-841-4141. If your region is covered by PPL, the telephone number is 1-800-342-5775. And if your region is Met-Ed, that telephone number is 1-888-544-4877. Thank you very much, and I will turn it back over to Commissioner Arbush.
And one last reminder, if you have gotten a census form in the mail in the last few days, that means that you haven't completed the census yet. So while you're at home, I would urge you to complete your census form. We are in the midst of a pandemic. We will need a lot of dollars of assistance to help us come out of this. And by completing the census form, we will have a much more accurate count of how many people live here in Montgomery County. Money that is allocated to this county for the next 10 years will be based on whether or not you fill out your form this year. So if you got the form in the mail, that means you haven't done it yet. If you could just take a few minutes to do that, we would greatly appreciate it. If you don't fill out this form, somebody will come knock on your door. So let's keep it so those people don't have to go out and knock on a lot of doors in the middle of this epidemic. Please fill out your form for the sake of everybody in our community. And with that, I will take questions.
What do you take from the data that you said shows that there may have been a peak last week?
Well, one day last week, we hit a high of about 24% of the folks that were tested that day came back positive. And we ramped up toward that day, and now we're kind of ramping back down. So we're hopeful that that was the peak early last week.
Does that change anything in your view of what we're doing and how we're doing it? Or
no, it means we're doing everything right. Hopefully we've been at our peak. Our hospitals are still doing okay. Now remember that testing positive is one thing. People getting admitted to the hospital is often something that happens later. In fact, some people are home for several days and then seem to take a turn for the worse. So that doesn't mean that we peaked on our hospitals, and it certainly doesn't mean that we necessarily peaked on the loss of life from this disease. But at least at the testing center, and I want to be clear, just the testing center, that population that came through there does seem to have peaked early last week. That tells us that the social distancing is working, that we seem to be decreasing that kind of general community spread, and hopefully we're on our way down. Hopefully this will hold. But if people go out, these numbers can go right back up. We are not at a place where people can start going back out.
So do you think that's encouraging though? I mean, I know originally you said the 16th might have been when you were expecting the peak, and so it seems like it was a peak early. So
the question is, are we encouraged by this? We are cautiously optimistic. That's all I'm going to give you, because I know how fragile this is. So if people think, oh, we're done, and they start going back out, we're going to be right back where we were 2 weeks ago.
Which leads to my next question. You know, a lot of people are getting cabin fever. Businesses are concerned about money. Do you have any idea when the county will reopen for business?
So the question is, acknowledging everyone's cabin fever, do I have any idea when the county will reopen for business? And the answer is, I do not. I think there's several things that are going to have to be in place before we can reopen for business. And remember, the goal with reopening is to keep as many people safe and healthy as possible, but also try to get as many people back to work as possible in a safe way. And I think we need three things. Number one, we need way more testing. We need to be able to do these rapid point-of-care tests similar to what you get in the doctor's office if you go in for the flu. We need to be able to test people in real time. Second, we need a much more efficient way to do contact tracing, so that if we find somebody's positive, they go into isolation, but we need a way to alert anyone they come in contact with that they may have been exposed. That, I think, can only happen electronically to do it in the magnitude that we need to do it. And that leads to the third thing, which is every one of us is going to have to put the common good ahead of our own personal wants and desires. That means that we might have to give up a little bit of our privacy on our cell phone and to allow ourselves to be tracked. That means that some businesses may not be able to open as quickly as others. And these are big challenges that we are going to have to face as a community. These can't be a one-off, and it can't be one county. It's going to have to be our region that really works together to do this together. Otherwise, we're going to find ourselves right back where we are today. So this country knows how to do this. We have pulled together during wars and other outbreaks. We can do this, but we are absolutely going to have to put our community and our country first and do this as a team. This cannot be an individual exercise. If it is, we will fail.
Would you say 1 month from now, your hope would be businesses would start to open? I mean, is there any idea?
I really can't say. I can't answer. The question is, would I say a month from now we could open? The thing that gives me the most pause is the ability to do the testing that we need to do this as safely as possible. And that's really what it's going to come down to, is having these point-of-care tests available in the quantity that we need them. That would be the safest way to do this. I'm not saying that there aren't other ways, but being able to test people is the safest way to do this. In the absence of testing, then everyone's flying a little bit blind, and we're going to have to, if decisions are made to go ahead and try to open things up, it will be much riskier than if we can do it with testing.
With the holidays last week, is there, with your background, is there any concern that data may have been skewed by maybe people who were recognizing religious days or anything?
That's a good question. The question was, given the holidays last week, do I think that the data at our community-based testing center might have been skewed? I don't believe so, because we did have 250 people sign up each day. We didn't see a tail. Now on Thursday, we didn't get to test 250 people because the weather intervened and literally flew one of our tents away. But we did have 250 people signed up. So I would say that there was not any decrease there.
Do
as
you?
best I can tell.
I'm sorry. Do you have any data on fatalities or deaths from long-term care facilities?
So the question was, do I have any details on fatalities or deaths from long-term care facilities? We don't have the precise number. We're still working on some locations of where people actually came from. But I can tell you that we believe somewhere in the low 40% of the deaths in Montgomery County are from individuals who were at long-term care facilities. But I don't have the precise number.
And I mean, it's an obvious question, but you touched on it, the challenges that they face, keeping it out and then limiting it once it's in there.
The long-term care facilities do face a lot of challenges. Some of them have to do with just the way the facility's configured. It's my understanding that they've all stopped visitors. That's been for quite a while. I believe that most, if not all of them at this point, are delivering meals to individual rooms so people are not coming together to eat. You know, they're doing everything they can to maintain social distance, but you know, the real challenge is this is a very vulnerable population, and when you look at this chart over here and you see the ages where death is more likely to occur, that certainly coincides with individuals who are more likely to be in a long-term care facility. So it's a very sad situation. We really feel for these folks. We're providing them the help that we can. I know the State Department of Health is trying to increase their level of support. We've got this new monitoring system, which we're hoping they'll all agree to participate in, those that have the electronic medical records. But it is a challenging situation, no matter how you look at it.
Are you concerned at all about the push by the federal government to not really let the governors kind of decide when to reopen the state and just open it at a certain date?
So the question is, am I concerned about the federal government trying to pick a date upon which to open? So I'm a doctor and a scientist, and I believe in data. And I think that you can only pick that date when you have the test data that would justify being able to open. If you pick some arbitrary date, then there's going to be very, very serious problems. And I hope that we can get the testing ramped up quickly enough with these rapid tests that can be done while you wait, such that we can start to test both for people who have the virus, so we know they're sick and they need to go into isolation and their contacts need to go into quarantine, as well as test other individuals who either knew they had COVID-19 or thought they might have, and test them for antibodies. So with both of those things, those pieces of information, then we can actually use data and science to make a decision on when to start to unwind this. But I think picking some arbitrary date could be a catastrophe.
Is there currently an antibody test in Montgomery County to test?
We do not currently have an antibody test here in Montgomery County. Most of those tests are not yet FDA approved, although I think a number of them are quite close. The one thing about the antibodies is we do have to remember that we don't really know if there is immunity to catching COVID-19 or the coronavirus again, and we also don't know if there is immunity, how long that immunity might last. But the hope is there'll be some amount of immunity for some period of time, and what we're trying to do is buy more time until we either have a treatment for the coronavirus or we have a vaccine. And if we can get to either one of those places, if we have a good treatment, which right now we don't, but if we find a good treatment, then that would also be a game changer. But hopefully, even before then, we'll have more testing available.
Governors of several mid-Atlantic states, including Governors Wolf, Murphy, and Carney, are coming together to talk about exactly what you're talking about right now. Is there anything else that you haven't discussed that you would want them to know, that you would hope that they address, or did you pretty much kind of already sum it up?
Yeah, so the question was that governors from the mid-Atlantic states are coming together to discuss this, how we unwind this, and I think that is great. I think this has to be a regional approach. You know, as we've discussed, this pandemic doesn't care about any sort of boundaries, political, geographic, or otherwise. So them coming together is exactly the right strategy. And I hope that they will use their collective might to get more manufacturing of these much needed rapid tests and work on a plan that makes sense and that is data driven and is as safe as possible, so that when we do unwind this, we don't find ourselves right back in this situation 2 or 3 months from now.
I just had a question about the voting. I don't know if you can talk about it, or Commissioner Lawrence.
Commissioner Lawrence can take that. Yep.
I was just going to ask, one of the press conferences, President Trump did kind of criticize mail-in voting. I just wanted you to kind of say your opinion on it, make sure if people were concerned about it was safe to register to vote by mail.
Yeah, the question is it safe to vote by mail? Well, absolutely the safest thing to do during a pandemic is to vote by mail. Voting by mail is not perfect, but when you have a situation where we have to consolidate polling locations, where we don't have poll workers, the best way to ensure your right to vote is to apply and to vote by mail.
And what is the concern by not voting by mail? Would it be lines similar to what we saw in Wisconsin?
I had nightmares in Wisconsin, seeing people standing. I mean, we are just going to be coming out of this on June 2nd. So it doesn't make a lot of sense to me to try to gather hundreds or potentially thousands of people together. And actually consolidating the polling locations we'll be bringing together greater numbers of voters than we would if we have our normal number of polling locations. So on June 2nd, to Dr. Arkush's point, I don't think we're going to be at that point where we want to bring people together in that manner.
Teresa, anything from outside? Okay. Anything else? Okay, great. Okay, so tomorrow, hopefully at 3. Thank you.